Good evening, everybody, and welcome to a guest lecture with the California Master Beekeeper Program. Tonight's featured guest is Dr. Lindsay Wilson. She is a veterinary doctor, and she is also a pretty decent beekeeper, vying for her journey level certificate this year. She is here this evening because she has a passion for science-based beekeeping, and keeping our bees healthy sometimes brings us up against some really critical questions that we need to ask ourselves. And one of those questions that several of those questions that Lindsay will be addressing this evening has to do with biosecurity for the backyard beekeeper. So please welcome Lindsay Wilson. Please tell us what you know about biosecurity for the backyard beekeeper. Thank you.
Thank you so much, Wendy, for that wonderful introduction. I'm so glad to be here. Thanks, everybody, for joining me on this Monday evening. So my presentation is about biosecurity. Essentially, what that is are practical things we can do in our apiary to help prevent disease and keep our bees healthy. A main focus of tonight's talk is going to be on the brood diseases and how biosecurity principles can help protect our bees. So a little bit about myself. I'm a veterinarian. I work primarily in small animals, dogs, cats, but I also have a background in 4-H and large animals of all kinds. I went to school at Ohio State, and then I'm a member of the California Master Beekeeper Program. I started that program in 2021 as an apprentice assistant. It's been a wonderful journey. And I also do work on the Education and Outreach Committee with the Honeybee Veterinary Health Consortium. They're a member of the Honeybee Health Coalition. So biosecurity. The talk tonight's going to focus mostly on hobbyist beekeeper biosecurity, but I do want to say that all beekeepers can use these principles to help protect their hives and keep them safe. It gets ever more complicated the more hives you have, and if you're moving those hives around, but these principles can work for any beekeeper to help protect their bees. We are going to talk about what bacterial diseases honeybees can have, how to check those hives if you suspect there may be trouble, the best prevention practices to help your colonies thrive. We're going to focus on the 2 brood diseases, American foul brood and European foul brood. We're going to cover tests that you can do to inspect your hive, things you can do in the apiary, and also tests where you may want to collect samples to submit to the USDA. Then we're going to discuss what do you do if you find you have a hive positive for either of these bacterial diseases. And the most important thing, prevention. How do we keep our bees healthy and protected from these brood diseases? So to talk about disease in the bees, we're first going to start with a review of the immune system of the honeybee. At the individual level, honeybees have their immune system, that they have the individual bee, but we also have immunity at the hive level because these are our super organisms. All the members of the hive work together to make a successful hive. For the individual bee, they have a hard, waxy outer covering called a cuticle. Their blood is actually a hemolymph, so they have hemocytes, but no adaptive antibodies like we do in mammals. So if you get your dog or your cat or yourself a vaccination, there's a way that the immune system responds to that administration of a vaccine to keep you healthy, and you can learn essentially with your immune system. Bees have a different way of doing it, and so they don't have adaptive antibodies in that way. Their digestive tract has protective, healthy, normal bacteria that's supposed to be there. Lactobacillus, my favorite, Snodgrassella, and Bifidobacterium. This is important when we talk about nutrition for bees, how it can affect their immune system. And also, if we have to administer medications of any kind, they can sometimes have an effect on those healthy bacteria while they're trying to help the animal fight off their disease. That includes honeybees. Also, there's vitellogenin. This is the way that bees transfer immunity through generations, generic or inherited resistance the queen gives to the rest of the bees in her hive, her direct offspring. At the colony level, we have the propolis protective inner envelope of the hive. Bees will exhibit hygienic behavior where those bees will take out sick or affected sister bees. They can also induce a social fever, increasing the temperature of the hive, and self-removal. A sick bee may choose to sacrifice herself for the good of the hive and leave the hive in general. So how this all comes together is we can have colony level stress that affects the individual bee and the brood, and over time, vice versa. Hive stress is often caused or can be caused by lack of floral resources, poor nutrition, weather effects, or parasites and pests. I think of the effects of varroa mite all the time when we think about things that can stress the whole hive. Foul brood diseases are bacterial diseases that are given to the larva from the nurse bee. So this can be a bit of a cascading effect within a hive if we have them ill for one reason that affects a generation of bees, and inadequate nurse bees or ill nurse bees for the next generation, then affecting the brood. So an entire hive can have a problem throughout their generations of bees within the hive from one agent or one stressor. First, we're going to start with some American foul brood review. It's called causative agent is Pinobacillus larva. This is a gram-positive spore-forming bacteria. The spores can persist in woodenware or in the hive potentially for decades. So these little spores, when the bacteria meets something that's trying to defeat it, can dry itself up and cause this very resistant spore. If it's in wax or comb, decades later, people have found this to happen. You think of the stories of, I got my grandfather's beekeeping equipment from the barn, I want to start bees, and you may have a problem. As the tales go, that might have been why he got out of beekeeping. He had a problem back then. So this stuff can persist for quite a long, long time. Here in California, American foul brood is a reportable disease. Unfortunate, but it's important that we know colonies with a clinical infection, ill colonies, must be euthanized. And we need to destroy that woodenware equipment. These hive bodies and frames need to be destroyed. Why is this so serious? Well, because of those spores. This is a disease that's very hard to get rid of once it's into your equipment and into your bees. Make the bees incredibly sick under certain circumstances. And so to protect all of our bees in California, we always want to take the best practices to deal with a sick hive, even if that does mean, unfortunately, losing that one particular hive to hopefully save neighboring hives in the apiary and our neighbors' hives as well. The remaining colonies in the apiary can be treated metaphylactically. That's the term for treating multiple animals in the same situation. So if we think of a herd of cows, metaphylactically, an entire apiary, all of the hives and the bees, with antibiotics to prevent the spread. You would consider doing this if you had one hive housed with other hives in the same apiary, one was sick. You want to protect those other bees from becoming clinically ill or showing overt signs of disease by treating them with antibiotics. The antibiotics we use to treat are oxytetracycline for American and European foul brood. For American foul brood, there's also the options of tylosin and lincomycin. So how do we know if our hive, how do we know if we suspect our hive has American foul brood? Well, the clinical signs of American foul brood, we can have a bad odor, often described as rotting fish, gym socks. For beekeepers that have seen this before, they say it's very distinct. I've heard of apiary inspectors walking into a yard and saying, oh, I know there is one here. I'm not that good. I have seen it at a couple laboratories that I've gone to for training, but it does have pretty funky smell. But I like to use some other tests to confirm my suspicion. You'll also see a shotgun brood pattern. If you look in the slide here, we have holes where brood should be, but they are missing, often because the undertaker bees will remove the brood if they notice that it's sick under the cappings. They'll also poke little holes in the cappings. They know something wrong is going on down there. So they'll perforate those cappings, classic sign of American foul brood, little perforated cappings looking for the trouble. Now, this often affects brood that has already been capped. So you see those little holes. You may also see some moisture droplets on the top of the cappings, which are circled in the slide. When we have a larva that's not been capped yet, it will kind of dissolve in the cell and will leave a firmly adhered scale on the bottom of the cell wall. If you try to pull it out with a pair of tweezers or forceps, it's not going to come. It is stuck in there. It's not going to come out. On equipment, it will also fluoresce under a black light. If you shine a black light onto an old frame that has a scale, it will glow green or blue. We have a picture of that later. And again, the death of the larva is usually once they have already been capped. Here is a picture of bees that have been affected by European foul brood. Now, this is a different causative agent. This is something called Melissococcus plutonius, a gram-positive bacteria. It does not form spores, and it does not persist for a long time in equipment the way American foul brood does. Symptoms tend to occur during nutritional stress. Bad weather can trigger it, or in the spring when you have bees building up, and then all of a sudden we have a loss of nectar or pollen flow, or we're waiting for that to happen. The bees got a little bit ahead of what nature had planned for that spring. Colonies used for crop pollination may be at increased risk for European foul brood. There seems to be some type of correlation or causation relationship here with beekeepers that take their bees to blueberry pollination. There's some very smart researchers working on why that may be. I don't know tonight to tell you, but it is something that has been noted. So when we have European foul brood, it is typically the uncapped larva. And there is a little bit of back and forth with both of these. But for European foul brood, often the uncapped larvae are going to be affected. They often look misshapen or twisted. Beekeepers will say they appear like they have a stomach ache. They're skinny. If you think of a skinny bee larva, their little tracheal rings become visible. They're having problems digesting properly. They've been fed this from the nurse bees, the bacteria, and affects their gut of the larva. So they have a stomach ache. They're very thin. The larval remnants dry into a little rubbery scale, so you can pull it out with forceps, in contrast to American foul brood, where you'll see that scale and it will not come out. And again, these are typically the uncapped larvae that are going to be most affected. Here's a beautiful brood pattern. So if you saw this in your hive, you should be very happy in the spring. If everybody take a look at this, and then on the next slide, we're going to look at a couple unhealthy brood patterns and talk about what may be going on with each of them. Okay. So we have 4 different affective diseases here on these honeybees. I'm used to doing this presentation live, so you'll have to keep your answer to yourself since I can't see any of you raise your hands. But one of these slides is affected by American foul brood. Can you guess which one it is? Our affected slide is number A. So the things that we can see in the slide that let us know the answer, we can see those perforated cappings. They're kind of in the center. We can also see the cappings are sunken, so they're dipping down into the cell. We see the shotgun brood pattern, but all 4 of these have what I would call a shotgun brood pattern here. We're missing different sections of our brood. But the perforated cappings and the sunken cells are your clues on this slide. We're going to look at slide B, very similar, perforated cappings, shotgun pattern, but this hive was affected by varroa mites. I know that because this was my hive. First year beekeeper, I went out and I had a dead out in January. Very, very sad, but I did an autopsy because that's how we find out, a necropsy. That's how we find out what happened to our bees so we can do better the next year or do differently the next year. Beekeeping is a hard thing to do. So we want to learn from any mistake we may have. So the clues are how I knew that we had varroa problems. Well, one, I knew my treatment and testing schedule, but for this hive, I did some of these field tests we're going to talk about next. I made sure we did not have American or European foul brood. And our clue here is the little guy, he's kind of right down in the, sorry, girl, right down in the middle on the bottom side, that is sticking with their pupal tongue out, with her proboscis sticking out. So that on emergence. So we have bees dying upon emergence, the bottom third of the slide there for B. That is a classic sign of varroa problems in absence of clinical signs of other things. Slide C is chalk brood. We can see our little chalk brood mummies sticking up through some of the cells on the top half of that view. And D is European foul brood. So kind of in the center, you can see a few very thin, twisted, brownish discolored larvae with their tracheal rings visible there. When I've given this talk live for a couple of people, I have, some people think it's one or think it's the other, and we have a little bit of a debate about why we think which one is which. But the tricky thing is that we can have hives with multiple problems. So you may see a bee dying on emergence, and you may have a little bit of chalk brood, and then you have a couple perforated cappings. How do you know what you have, especially if a hive was under stress? We can have multiple things affecting that hive. So I guess this is just to say this can be challenging, and that's why we rely on testing to help us figure out what is really going on. So this slide goes through the comparison between American foul brood and European foul brood for our clinical signs, and we can see that there may be a lot of overlap with what you see, and there's very possibly more than one thing going on at a time in some hives if they are highly stressed. So how do we test? How do we find out what's going on? So the first field test we can try, we're out in the hive, we go, what's going on with this cell? We can do the matchstick test. Take either a matchstick or a nice clean stick, whatever you got. We're going to stick it down into that cell. We're going to swirl it around and macerate it. We're going to pull it out to see if it's stringy. With American foul brood, the proteolytic enzymes that are caused by that bacteria dissolve the little larva into this spindly, string cheesy-like substance that can be stretched out over 2 centimeters from the cell when it's stuck to a wooden object, which is kind of gives it that little bit of tension there. It's not typically going to happen with European foul brood, but weather, temperature can affect the results. So the matchstick test is a tool to be used, I would think, with other things. If it's very clear with smell, appearance, and the matchstick test, you could be certain with those tests, but if you're guessing if the matchstick test is accurate, you may want to use some other tests as well, because it's a very subjective thing. Is this 2 centimeters as I'm pulling it out? And the other thing is that old frames or old equipment, it's not going to do this. So if you have dried scales in that cell, it's not going to come out at all. And you're going to put your stick in there and not get a positive result on the matchstick test. So a good tool, but not always conclusive for what's happening. We can use a black light test. So if you remember that those rubbery scales from American foul brood that are adhered or stuck to the bottom of the cell, they're going to fluoresce under a black light. You can buy an inexpensive black light. It's $15 at your local hardware store. There's a great Apiary Inspectors of America guide. You can see the citation at the bottom of the slide here that talks you through how to use one of these black lights. And we can see in the image there that it's going to glow greenish, tealy green whenever you fluoresce it. Now, this can be complicated by some pollens that fluoresce. So if you see fluorescing, it doesn't always mean American foul brood, but it's a great way to check equipment, especially if you're considering buying used equipment or you have a dead out where there's nothing really left to do a matchstick test on in the hive. It can give you a good clue. It doesn't have to be in pitch black. You can put your coat over your head under a tree and shine the black light down into the cell, point it towards the bottom of the cell. Should be enough for you to be able to see it. This is my favorite when I'm not sure, the Holt's milk test. It's inexpensive, you can do it in the field, and it's easy to do. So with American foul brood, these proteolytic enzymes that dissolve our larvae, so we can pull them out with the matchstick test, also dissolve the proteins in milk. So we can use very dilute skim milk, 1% milk powder, barely there, in a little tube with what you pulled out with your matchstick from the cell and put it into the tube, shake it up and put it in your warm pocket for 10 to 20 minutes. If it's positive, it will have turned this iced tea brown. You can see on the very bottom test tube on the slide. European foul brood may change the color a little bit, and that's because you got brown goopy hive stuff in skim milk, but it's not going to cause it to kind of coagulate and pull away that we do for the American foul broods there. So this is a test of the photo credits to Randy Oliver. He's got some wonderful content on his site. This is also with the Honeybee Health Coalition. You'll be able to find this Holtz milk test. Inexpensive, easy to keep around. Doesn't cost very much to have this, something maybe readily available if you're ever suspicious or work with a lot of bees. We also have the lateral flow tests. So these are commercially available tests. They work with similar technology to our COVID tests, and that we would take a piece of sample with their diluent they give you in the kit, and the slide will give you a positive or a negative. Now, these cost about $16 a piece. In 2023, I think it's gone up a little bit. Plus, you got to get them shipped, and they do expire. So these tests will last about a year to 18 months from when you buy them to be considered valid. An expired test should not always be trusted. There's a chance it could give you a false negative or potentially a false positive. It was affected by heat or sun or just been sitting around too long. So these are very good, reliable tests if they're done properly. If you have a hive where you say, I'm just really not sure, I've done the other tests, I'm not sure, I would say consider a lateral flow test before making any major decisions. Good idea to have a couple on hand. And of course, if we find out we have a positive, or if we are still wondering what our test results concluded, we can always send a sample to the USDA. Why would we do this? Well, they have some testing capabilities to help us confirm our diagnosis. Be very sure what actions we need to take for our apiary, because sometimes that may mean treatment or quarantine or euthanasia. So we want to be confident in what actions we're taking. They also can screen for antibiotic resistance, but you have to request it on the form. Some types of, some strains of American foul brood might be resistant to our primarily used antibiotic oxytetracycline. So always a good idea to just ask for antibiotic resistance testing. It is free, but it may take time for results. So that's why we have many options for tests to be able to make decisions for our hives. Our sample guidelines for USDA submission, we want a 2 by 2 inch piece of comb with brood, as much dead or discolored brood as possible. It's about the width of my hive tool when we go in there. No honey. If you send any honey in the sample, it can potentially cause false results. Also, it's going to make a big mess. The USDA office, avoid honey in your sample. We want to wrap it in a paper covering, paper towel or paper bag, newspaper, no plastic. The plastic will cause other bacteria or mold to start to change the submission sample and could alter our results or affect them. So we always want to keep it in a paper wrapper. If you can't get a good 2-inch piece of comb of the affected brood with no honey, you can always take a smaller sample. So if you tried the matchstick test and you've got that stick you stuck down in there, wipe it on a 3x5 note card, carefully seal it up and send it to them. They may still be able to get you some test results, even if it is not the ideal full 2x2 inch comb. Okay, what do we do if we found out we have a confirmed American foul brood colony? So because this disease can potentially be so contagious within an apiary and affect the hives the way they do, we always want to deal with this colony on the day the disease was discovered, either in the evening, once all the field bees have returned to the hive, or first thing the next morning. We do want to make action as soon as we are confirmed on what's happening. In California, this is considered a reportable disease, and there are some laws and regulations governing how this is going to be handled. I know it is always sad to talk about euthanasia with an animal, but there is very good reason why these rules are here. And this leads to us having very low rates of American foul brood in California. So although it is a sad thing to talk about, it's important to know that that's really there for a reason, to protect all our bees. In some states, American foulbrood is not reportable, and folks will use the shook swarm method. Do not recommend that in California or ever. We'll talk a little bit more about that further on in the slideshow. And then we have to burn the hive equipment and destroy it, because the spores will remain in that equipment, and that equipment can be contagious to any bees you put in there in the future. Not worth the risk for a couple boxes of wooden boxes. Get new stuff. With European foulbrood, we have many more options, okay? So hives affected with European foulbrood. If you are a beekeeper, really with very few beekeeping neighbors, and you get one hive in that has European foulbrood, she's new, you got her from someone, you may want to deal with it the same way as American foulbrood. You may decide to cull that hive or remove her from your apiary to reduce the disease spread. But in other circumstances, watchful waiting and feeding could be enough to get the hive to recover. You always want to make sure you're going back in to re-inspect them, that they are improving with changes in the weather and with feeding. And if they're not, we would want to talk about treating with oxytetracycline or antibiotics. What do we do with the colonies that are in the same yard as the affected colony? So with bees, we always treat at the apiary, the whole apiary level. We have to think of all of these bees having been intermingling to some degree and sharing their germs with each other. So if we find a disease with our bees, we should quarantine the apiary. Don't move any bees in or out. Don't move any equipment in or out. That hive tool stays there. So does the smoker. Ideally, your bee suit. In some circumstances, bees moving, working bees that go to pollination services, they have higher rates of European foulbrood. Sometimes we use antibiotics with a prevention mindset if we know an animal is going into a particularly stressful situation. But if we use antibiotics, we also have to know the honey that was generated by those bees is not for human consumption and should not be fed back to bees. So we do have to throw out any honey given to those bees while they're on antibiotics. So for those bees going to pollination where that's their job, not making us delicious honey, we may need to think about it a little bit differently. How does a hive even become infected in the first place? We can have, with either American or European foulbrood, horizontal transmission. This is where often a beekeeper activity or purchasing new bees, moving bees place to place, will take bacteria from one hive and move it into another hive. So if you see the beekeeper's gloves on the top, leather gloves will hold bacteria or potentially bacterial spores on those gloves. We can also have bees that we've purchased or gotten from a friend or caught a swarm that we move into the apiary and we didn't know they were sick until they start having brood in there. We realize, oh, we have a hive that could potentially transmit disease back and forth between the hives. Bees can also do it themselves. So robbing behavior, particularly with hives within 1 kilometer, it's about half a mile of a weekend or a dead colony, see nothing but a delicious buffet of all the honey that was left over. They will go in there and take the honey and the resources and also some bacterial disease back with them to their own hive. In studies on drifting, it's not really shown to introduce a severe number of spores. So drifting, we always want to think of preventing that for many other reasons. But small hive beetle, those dirty little guys, they have been shown to bring American foulbrood spores into hives under certain circumstances. So we want to prevent all types of parasites within the hive when we want to also protect their health from bacterial diseases. Can also have vertical transmission. This is colony reproduction and swarming. When we think of a hive reproducing, it's probably a sick hive isn't necessarily going to have a swarm, reproductive swarm, but they certainly could have an abscond, which we won't know if we found them in a tree why they left. And so anytime you do catch a swarm or you pick up a nuke or a split, you may want to keep them in a separate apiary for a little bit from the rest of your productive hives. We're going to talk a little bit about quarantine towards the end of this, but that's a great biosecurity principle is if you're bringing new bees into your established apiary, we may want to keep them in a separate area with some separate tools until we're sure they are healthy. If we find that they're not, we can take care of it. So I mentioned any honey that could be produced by a bee under treatment for antibiotics, we don't want to eat it, and we don't want to feed it to other bees. That's because when antibiotics are given to an animal, it's going to create an antibiotic residue. What a residue means is that these are the products from the metabolism of the antibiotic and things that are formed as the body's using the antibiotic, and also parts of the antibiotic that got metabolized. So approved antibiotics for honeybees, oxytetracycline is approved for American foul brood and European foul brood. Tylosin and lincomycin for American foul brood, those are given in water. The withdrawal period, meaning how long do we have to wait after the last dose of antibiotics before we trust that this honey is safe for us to consume, it's called the withdrawal period. We also have this for many other animals. If we think of chickens, we have withdrawal periods for medications for safety for their eggs. For cows, we have this for milk. And for honeybees, we have this for their honey. So for oxytetracycline, the labeled withdrawal period is 6 weeks from the last application of antibiotics. For tylosin, it says 4 weeks on the label, but some beekeepers only ever use tylosin in the fall because it may persist around in the bees and the honey longer than it says on the paperwork. So tylosin is often recommended as only a fall treatment for bees. How do we get these antibiotics? Well, it's either a premix. The feed mill at Man Lake or Dedant will premix your antibiotics in vitamins and powdered sugar for you. Or you get a prescription, which is the straight antibiotic, and you have to DIY or do it yourself for oxytetracycline. For either of these, you do need to have a veterinary prescription. That is a relationship with a veterinarian that has helped you make sure that this is what you do need to do for your bees because of that withdrawal period and because of the risk to humans from antibiotic residue. And we want to make sure we are applying these antibiotics or treatment appropriately as well. For the premixes, you have veterinary feed directive to get a medicated feed, often powdered sugar, vitamins, and oxytetracycline. I just checked on Man Lake and Dedant. The smallest size now is 1 pound. It used to be 50 pounds. That's enough for so many bees. Now they have a 1 pound size. So that's a course for about 5 hives. The way you do it is 3 applications, 4 to 5 days apart. So that's a little bit over 2 to 3 weeks of treatment. And then 6 weeks after that, we have to wait until we want to consume the honey. For big commercial beekeepers, the veterinary feed directive is nice because they can get you 50 pounds of premix that you may need if you have thousands of hives. For a prescription, you're doing it yourself. So you get the antibiotic, you mix it up with fresh sugar syrup or fresh powdered sugar each time. You're dusting it over the top of the brood frames. If you dust powdered sugar on uncapped brood, it's going to kill those broods. So you want to be careful how you apply it. You want to mix it up fresh each time. And again, we would always want to make sure that we're waiting 6 weeks after the last application before we trust that honey. So how do these antibiotics affect the bee? So they help kill the bacteria with the bee, but they also deplete the good, healthy bacteria, part of the bee's immune system. In a couple of studies of bees given these antibiotics, they can have decreased capped brood amounts and reduced immune function. They don't kill the spore form of American foul brood. Remember, we got to get rid of all the equipment. American foul brood, we treat the unaffected bees in the other hives in the apiary. The sick hive does have to be euthanized. And we can't feed the honey from these hives to other bees. We know these people can't have it, but we can't give it to other bees as well because of those antibiotic residues. Sometimes I'll have beekeepers ask me, if this is such a problem, why can't I just preemptively give my bees some antibiotics? I want to make sure that they stay healthy. But actually those antibiotics have harmful effect to the bees. This is something that you would only want to take antibiotics if you are sick. So preemptive use for backyard beekeepers, people that want a honey crop from their bees, really doesn't help us out. It's a tool for us to use if we have a sick animal, but like with a cow or a chicken, I don't want to consume food from an animal that's been sick. I also don't want to give medications to a healthy animal. So our human health risks from these antibiotics, so we can have humans that get skin or gastrointestinal issues. Some people will have an anaphylactic reaction, even at very low doses. And antibiotics used inappropriately can contribute to resistance. We already know some strains of American foul brood are resistant to oxytetracycline, our go-to antibiotic. And so in other animals, when we reduce unneeded antibiotic use, the antibiotic resistance goes down and the tools we use work better for us. So we want to reduce the building resistance of American foul brood. When laboratories have tested international honey samples, so we have some antibiotics used that aren't legal in the US and aren't safe for human consumption and shouldn't be in the honey to begin with. So on some international samples, they've actually found fluoroquinolones. I, as a veterinarian, think of that as a big gun antibiotic. I use that when nothing else is working. Sulfonamides, which can cause a lot of reactions in people. And these results from the samples were way above the European Union standards. These were international samples tested in the EU. Why did these international honey samples have so many antibiotics in them when we know that we shouldn't have any antibiotics in our honey at all? Well, it could be that we have had improper agricultural practices. Maybe those beekeepers weren't trained on the risks of using these antibiotics to themselves or the bees, or nobody's monitoring. And fortunately, money sometimes could influence people to do something they know they otherwise shouldn't or isn't good for the consumer of the product. But on the silver lining here, for all of us here, backyard beekeepers, what better advertisement is there for our healthy, local, backyard honey? We know our bees are healthy. We know that honey is healthy for us and for the friends in our community. So great advertisement. We know our honey is safe. I will also get asked, what about using, I've heard a lot of things on the internet or from my friend, maybe we can use something else. There have been many recent studies investigating alternative solutions or strategies for the control of American foul brood, propolis, essential oil, probiotics, other bacteria and phages. And while in those studies, it shows some of these may have a good positive effect, nothing is as effective as antibiotics. Especially when we do those laboratory trials. And so if I have an animal that's sick, we can do these things and antibiotics. We can try propolis essential oil and treat them, but I don't want to leave it to chance. I want to make sure my animals are getting healthy and that we're preventing further spread of disease. So how do we prevent our hives from getting this? We talked a lot about what we do to find out if they have it, how we treat it. I love prevention as a veterinarian. I want to keep all our animals healthy from the get-go, so I never have to prescribe antibiotics to them, and I get that delicious honey. So for biosecurity, these are all the measures we use to prevent the introduction of the disease and the pathogens. We cannot control where our bees go, but we can control what we as the beekeeper bring in. So this is cleanliness and sanitization, quarantine, hive inspections, checking our hives, and managing our dead-outs. This is the most exciting final portion of our talk. We talk about sanitization. I love sanitization. So if American foul brood is suspected, and with European foul brood, we always want to take a sensible, thorough approach to cleaning our beekeeping equipment. This is cleaning off our hive tool, get all the propolis and waxy gunk off of it. We want to scrub it really good anytime we're done with the hive. Comet cleaner, old-fashioned Comet cleaner works really, really good. So does chlorhexidine if you have that available. We want to scorch that hive tool and burn it off. You can put it in the smoker, pump the bellows, get a good flame going. I like to use a plumber's torch, and I'll torch the heck out of that hive tool and make sure I'm confident it's clean. Leather beekeeping gloves. If you wore your leather gloves to help check on an ill hive, you may want to dispose of those. Get a new pair. Nitrile gloves can help protect your hands and keep them clean. So you don't have to wash them as much, but keep your hands clean and protected. Bees often don't recognize it as your hands, so less likely to produce stings. They can still sting through them. But I love nitrile gloves when checking out an ill hive. If you're working in a larger apiary, you want to change your hive tool, your smoker, your gloves, your suit if you can, after checking a sick hive and before moving to a healthy hive. With equipment and feeding, good prevention practices: only purchase new equipment from known and reliable suppliers. Unless you really know how to check out your stuff, novice beekeepers should ask for help, and always clean it thoroughly before using it in your hives. I did this talk at a local club. I heard that they had had several cases of American foul brood the year before. Most of those cases came from folks buying used equipment, trying to save a little bit of money and not knowing that that was a problem for them. So if you're new, if you're not really confident checking out used equipment, making sure it's safe, and a little bit more, protect your bees by getting new stuff. When we feed bees, we can prevent robbing by using internal feeders. The in-frame feeders, or if you have the Boardman front entrance feeder, put it in a hive body on top of your hive. Only use the Boardmans at the front entrance for water. Sugar syrup at the front entrance encourages other bees to come by and rob. It also gets ants and wasps coming by. So you can use metal robbing screens and entrance reducers. We only want to feed honey or pollen from your own hives or trusted sources. I got some honey frames from my trusted beekeeping mentor when I first got started. I knew he was taking good care of his hive, so I felt confident in that. But do make sure you are comfortable with who you're working with if you take frames from other keepers. Never ever feed store-bought honey for a couple reasons. Antibiotic residue that we talked about, and we could have somebody have collected honey from a hive they didn't know had American foul brood and introduced spores to your bees. In your apiary, we want to keep our apiary neat and tidy. All that burr comb you scrape off, have somewhere to take it. If we leave it out, it's going to encourage robbing other bees and problems to come by. Each year, think about removing about 20% of the older dark brood comb. It can have buildup of residues and pesticides. That's what wax does. It keeps things in it. So remove 20% of the older comb each year. Culling those frames reduces the exposure to pesticides and development of potentially antibiotic-resistant American foul brood, and reduces miticide resistance in Varroa if we're getting rid of that wax that has stored things over years. Keep quality feeder frames for your own bees. If you've been doing it a couple of years, save some honey back for the bees next year that you know is healthy honey. For honey management, try to avoid extracting honey from the brood chamber. Any honey that was on the hive during antibiotic treatment, any honey that was produced, we do have to discard it. You don't want to use it for anything else for the bees and for you. Quarantine and dead outs. This is the tough stuff, guys, and we're almost to the end. Whenever possible, if we have a new swarm or a newly purchased nuke package, we want to quarantine it away from the other bees. If we have a positive hive in our apiary, either with EFB or AFB, we want to stop movement of bees out of that apiary. Keep all your tools and equipment and PPE, if you can, there for 1 year. That's a long time in beekeeping, but over a year, you can see if problems are popping up anywhere else. Treat those bees, get it under control before you risk taking it to another apiary. Always remove, discard, and burn suspected woodenware. If you're worried about whether it's okay, it's better to throw out that frame and get a new one for your healthy bees. And hives within 1 kilometer are most at risk. So with dead outs, it may not affect you. You're like, I don't have any more bees. It's been a tough year, but taking care of those dead outs will help protect our neighborhood bees. So we're a big beekeeping community. We all have to work together for each other's health and safety of their bees, because these bees go wherever they want. We can't tell them where to go. Vaccination. When we talk about prevention in other animals and ourselves preventing disease, we can get a vaccine. Recently, there's been a development of a vaccination for honeybees. Some of this information I updated here for us just yesterday. So DeLon Animal Health, they're out of Georgia. They have an American foul brood vaccine they've delivered. How is it administered? This is different than a vaccine in you and me. My dad makes this joke that I go around with tiny little needles getting every bee a vaccine, which I think is very funny. But for this vaccination, they actually eat it. So it's given to the queen. They mix it up into queen candy, and they do it at batches of 50 queens at a time at the queen producers. They have to be fed it by the attendants every day for 7 days. for her to get that immunity. She passes that immunity to all of her offspring, but if she produces another queen, I wouldn't trust that that queen would also then be able to pass the immunity to her offspring just yet. If we think back to the way the honeybee immune system works, this vaccine is really only for that queen and her direct offspring. It's been tested safe for the bees and safe for the honey. So if you have a vaccinated queen, your honey is going to be fine and safe. Hives were followed for a year with no significant negative effects. And there's several bee producers that are producing these queens. I've been debating whether I would get one. I think if I had bees in a high risk scenario where I'm worried about them, I would consider it. But Delon Animal Health has that information for you if you want to check it out. Now, this is my favorite part, the idea of eradication. Dr. Megan Milbrath, she's absolutely wonderful, and she wrote an article on whether we think we can get rid of this disease. There's other diseases in animals that we've been able to get out of the United States, so we don't have to worry about it anymore. So this is my hope and dream for us as beekeepers. Eradication of American foul brood is possible, especially as we get better screening tools. More veterinarians and diagnostic labs are there to help us as beekeepers. And eradication requires that all of us beekeepers work together. We want to eliminate sick colonies, frequently screen our other colonies to make sure they're healthy. And so eradication of American foul brood would be wonderful for all of us together. Steps of eradication: checking your hives frequently, knowing what's wrong with your hive if you suspect a problem, using our testing. Early detection saves the other hives in the apiary. So if we catch a sick one and deal with it, we can also help protect those other hives. And then monitoring all of our hives. I've put a link up here to the California Master Beekeeper Program. I think everybody here knows what that is. And then also the Honeybee Health Coalition that has some wonderful resources referenced in the slides. And we've reached the end. Thanks, everybody. And a little bit of time for questions too.
Thank you so much for your generosity of time and really valuable information this evening, Lindsay, on AFB and EFB and how to mitigate for that. Yeah, it's been highly informative. Thank you. Thank you so
Thank you,
much.
Wendy.